Roberto, I have started the webinar.
Well, hello, everybody. Good afternoon. Thank you for joining us at this webinar with the League of Cities Latino Caucus. I'm Roberto Uranga. I'm the president of the Latino Caucus, and I'm also a member of the Long Beach City Council District 7 here in Long Beach. First of all, I want to thank our speakers and, of course, our moderator, Erica Arriaga, for helping us put this together. We are obviously very happy and proud to present this, as we need to also look at what has happened in the last year. My fellow board member on the Latino Caucus, Alicia Aguirre, will be monitoring this webinar. Alicia is a member of the Redwood City Council. She is the first Latina mayor in the history of Redwood City. Professionally, she's a professor at Cañada Community College and has taught there since 1988 in the English Institute of the Spanish Department. She holds an MA degree from Eastern Michigan University and has done doctoral work studies in social anthropology at the Universidad Iberoamericana in Mexico City. She also is a regional leader focused on issues of social equity and immigration and immigrant rights and affordable housing, transportation, and economic empowerment for all social economic disenfranchised residents in Redwood City and the region. So with that, I want to welcome Alicia.
Thank you, Roberto. Can you hear me?
Yes, we can hear you.
Thank you. Thank you. Welcome, everyone. It's great to be here, and thank you so much for everyone for taking the time today during this sometimes spring break for some people, but today's webinar is brought to you by the Latino Caucus Legislative Committee. We meet monthly. We work on issues that are very important to the Latino community statewide. And we know that COVID-19 is something that's been hitting us the hardest. It's a top priority for the Latino Caucus. It's been in our communities, in our farm workers communities, so disproportionately, especially in areas of health, education, and in a lot of our small business, a lot of our taquerias, a lot of our grocery stores, and you know the rest. But we're committed to informing the state and federal leaders of the distinct and often overlooked areas affecting Latinos during this pandemic. And a lot of them have to do with language barriers related to emergency responding. Definitely, we know it has to do with the digital divide affecting education, and I can attest to that as an educator who teaches every day of the week with my students and how they get knocked off, and the minimal aid of protections available to many of the undocumented communities. So we look forward to hearing from our distinguished speakers and perhaps receive news of hope and call it to action for the members to take back to our communities. We will have a Q&A for questions at the end of the program, so be sure to type your questions in the Q&A box. So first, I'd like to introduce Senator Josh Newman, who represents District 29, and he represents 16 cities, including Chino Hills, Brea, Fullerton, and others. After graduation from Yale University, he served as an artillery officer in the United States Army, which included duties with the nuclear weapons unit in South Korea. In 2012, founded Initiative Armed Forces to Workforce to assist young military veterans in the pursuit of rewarding career-oriented employment. In office since 2016, he has successfully guided more than 20 pieces of legislation that supported veteran services and mental health resources, improve local schools, help businesses create jobs, and protect open space. And in 2020, Senator Newman was appointed as the chair of Special Committee on Pandemic and Emergency Responses. And as chair, he has conducted oversight hearings on topics of importance to our caucus, such as childcare during and after COVID-19 pandemic, K-12 distance learning, how students across the state are being served, and how they are accessing online learning in the workplace. We look forward to hearing from his statewide comments on the pandemic. Welcome, Senator Newman.
Thank you, Alicia. It is a pleasure to be here today. It's a pleasure to join my colleagues. Senator Raza, nice to see you. And Assemblyman Rivas, nice to see you as well. I get to go first because, as you gathered, I have the least Latino name of probably anybody involved in this forum, except for probably Nathan Bass on my team. But I have the privilege of serving as the Senate's chair of the Special Committee on Pandemic Emergency Response. And in that capacity, I have had kind of an interesting vantage point from which to kind of observe the pandemic since I was elected in November, and to interact on a weekly, sometimes daily basis with the governor and his staff on challenges and changes as we moved through it. So in my comments, I want to just kind of frame the pandemic a little bit sort of by phases. And I'm going to go through kind of the 4 phases that we've experienced. And then my colleagues will have, I think, some, more perceptive, more specific observations about their constituencies. But that first phase, as we all recall, started a year ago. I mean, it's been well over a year since the most serious public health crisis in any of our lifetimes got started in earnest. We knew at the time it was coming. We had known since late December, early January, that there was a virus coming from China, but we didn't know the dimensions of it. They didn't know the epidemiology or the physiology of it. But we knew there was something coming. It really hit California hard in March of 2020. And this was a thoroughly new experience, I think, for all of us, and particularly for state government, and also for county governments, which have jurisdiction over things like health and safety. And that first phase was sort of characterized by closures, by confusion, and by a massive recession. As after the first lockdown order, the governor was, I think, brave. Very courageous, given the information at hand, to order the first stay-at-home order statewide, but the repercussions of that were vast, and so the beginnings of a very serious recession for the bottom half of our wage earners in California started then, and it has not been particularly mitigated since then. Second phase was the sort of ongoing discussion about protocols, how to handle various closures. Remember the implementation of first the guidance from the county guidance, and then eventually the tiered response, right? The county classification tiers, and at about the same time we had the first of now 3 surges. Each of those surges was successively worse. And we didn't realize at the time how much worse it could get until we got into kind of the late fall winter surge that has been absolutely devastating. So California has now lost over 50,000 lives during the pandemic. Some 30% of the state have probably been exposed in some fashion to COVID. I myself had COVID. It wasn't a particularly, I was probably very fortunate, but very scary. And the sort of the epidemiology of the disease is still not fully understood. And that was the context in which we were trying to figure out what was safe, what was necessary. And if you all recall, there was the kind of initial controversy about masks. We didn't need masks. We wanted to reserve those masks for healthcare professionals. Turns out that this is an airborne respiratory virus. And never in our lives did we ever think that we would be living in the era of the mask, as we've gotten so accustomed to. And we still don't really know some of the science about the disease, but we do know that the mask guidance that we were given, that thankfully most of California has adhered to, has had a significant impact on reducing exposure, getting us to the third phase, which is the vaccination and rollout phase. And we are very lucky to be living in the moment we are, in that never in the history of science, and in fact in humankind, has a vaccine, and now 3 approved vaccines, been developed as quickly as they have during the pandemic. What would have taken 10 years or more, as recently as a decade ago, was done phenomenally quickly. And so we're very fortunate now to have the Pfizer BioNTech vaccine, the Moderna vaccine, and now the J&J vaccine in California, and hopefully a couple more as we move into that. But California, being as vast and as complex as it is, even as the vaccine allocation started coming to the state, was not clear about how best to distribute the vaccine, and you had some very difficult choices that related directly to the public health response and kind of the parameters of the epidemic, the pandemic. And so we've learned some hard lessons, but in the recent several weeks, we've made some progress, specifically getting vaccines to those communities that have been hardest hit, not to the extent that maybe we need to or we should have early, but as vaccine supply has increased, we are now in a position where some 30% of Californians have gotten either their first or second vaccine. And we're working steadily as the vaccine supply increases over time toward something like herd immunity. But that is a daunting task for this state. In a state of 40 million people, that threshold, about 75% of your population to get vaccinated to create, to effectively block the pathways for in transmission infection is no small thing at all. So we're somewhere in the order of 15 million Californians actually vaccinated and making some progress. And thankfully, even as we've gotten better at distribution, as we've gotten better at targeting, we are getting much more vaccine, and we have the assurance of steady increase in supply over the next several months. And so, we will, I think, within the next 6 months, get back to something close to normal. That will get us into our fourth phase, and that fourth phase will be about reopening California, rebuilding California. And I'm going to try to be brief and leave some time for my colleagues, but I think that one of the most striking features of this public health emergency, it has shown a very stark light on income inequality in California, and the challenges that we face, and the work that needs to be done to make sure that we not only address the public health emergency, but we need to make sure that every Californian in the reopening, but in the future, has access to healthcare, has access to the public health resources that are necessary. But what we've seen in this recession is there's sort of two Californias. One California can work digitally and has been able to do things like this, work on Zoom, and they have not been inconvenienced, but the economy has done just fine. And California's fiscal situation as a state government is in astonishingly good shape, all things considered. But as you look at sort of the bottom half of our wage earners, that's a very different California. That includes, regrettably, a very large segment of the Latino population. They have been devastated. These are people who are frontline workers who could not afford, in fact, just logistically could not work from home. They do the kinds of important work that we all depended upon during the pandemic. They are grocery workers, they are transit workers, they are healthcare workers. And for those folks, they have not only been exposed in much larger measure to the risks of the pandemic, their finances and their resources have been devastated. So the work that we need to do in California is to make sure that we make them whole. And as we do so, that we make sure that nobody is as vulnerable as that share of Californians in any future recession or public health emergency similar to this. So with that, I'm sure we're going to have Q&A, but I'm pleasure to be here. Thank you for having me, and I will turn it back to Alicia.
Thank you so much, Senator Newman. I'd now like to introduce Senator Durazo, Senator Maria Elena Durazo. She represents District 24, which includes 28 neighborhoods such as East Los Angeles, Boyle Heights, Chinatown, East Hollywood, and Echo Park. She attended St. Mary's College in Moraga and then earned her law degree at the People's College of Law. In college, she became involved in the Chicano movement and then the labor movement as an organizer for the International Ladies Garment Workers Union, later called Unite, the Union of Needle Trades, Industrial, and Textile Employees. In 2008, she served as the vice chair of the Democratic National Committee as national co-chair of the Barack Obama presidential campaign. In 2006 through 2014, she was the first woman secretary-treasurer of the Los Angeles County Federation of Labor, AFL-CIO, the second largest labor council in the country, and served as a national AFL-CIO executive council. Elected in 2018, the senator is currently the chair of the Legislative Latino Caucus. Much of her legislation represents important issues of equity and safeguards for underserved communities, domestic, garment industry workers, immigrants, elderly, etc. Thank you for the important work that you do, and I'm pleased to welcome you, Senator Durazo.
Thank you, Alicia. I appreciate you very much and all the work that you do, and also greetings to my colleagues in the state legislature, Senator Newman and Assemblymember Rivas, and everyone else who works in public service. Assemblymember Rivas is our vice chair of the caucus, so we're a team there along with everyone else. I just want to, and I really appreciate that you started with Senator Newman's report, because he lays out the broad context for everything that was going on, has been going on for the last year plus. And so I think it's really important to have that as our base for understanding what then happened. And Senator Newman sort of ended around the issue of the impact that it had, especially on Latinos. What we started to see as a Latino caucus very early on was that we were going to be left behind. The Latino community was going to be left behind. And I say this because it took some time, I don't know, a month or so, maybe more, for us to even start tracking within communities, within neighborhoods and neighborhoods of color, to be able to see what was going on. You know, were the positive tests within the numbers of our communities? Were they higher? Were they lower? What was going on? Why? And unfortunately, it took some time to even begin to get numbers. That's one thing. When you're behind on data, then it's a real problem. There were other issues that weren't taken into consideration as we developed the strategy to move forward. One of those was in terms of our housing situation, a lot of overcrowded housing. So our communities are not as much, the numbers are not as much unhoused as we are overcrowded. And that played a very special role in the way that the spread of the pandemic hit the Latino community. Within the overcrowded housing, 2, 3 families or core members of families, you had multiple earners. We have the highest percentage of multiple earners within a household, which means that they go out and work in 2, 3, 4 different places and then come home. And then there's the connection to the spreading of the virus. And we were not making the connection in the state between the housing situation and the workplace situation, and how those were significant factors, unfortunately more negative than not, significant factors in why Latinos ended up with such high, way higher numbers than our population. So data, testing, and now vaccination, we seem to be always a step behind or several steps behind. And again, the uniqueness of our community and the fact that we are 40% of the population of the state, and in some places 50, 60, 80% of the population, we really needed to have sooner than later a better understanding of what was causing the spread. So as a caucus, we tried to get real-time solutions, as well as programmatic and more midterm and long-term solutions. So we really zeroed in a lot on workplace safety, and pushed real hard to require workplaces to give employees information. Just give them information about what was going on there. What was, were they getting exposed to the virus? And that information wasn't even given out to the own employees. We had numerous locations in the state in industries that are primarily Latino, where those Latinos were going to work. They couldn't stay home. They were doing the work that the state needed them to do, that all of us needed them to do, without anywhere near the protections that they needed. The workplaces are egregious violations in many workplaces and many industries. Here in LA, in the garment industry, I assume Assemblymember Rivas will talk about food processing plants, egregious violations. Hundreds and hundreds of workers in in different work locations that weren't given the minimal PPE. So these are very glaring issues that we could have, should have addressed sooner, and we finally started to catch up with that. But I would say that the system has not caught up with these issues and with these problems. Our system in California is still treating the Latino and immigrant communities and African-American communities as if we're all equal in the system. And the solutions and getting the vaccinations out are not going to be equitable unless we change the system. And I would just end by saying one of the most glaring problems that we have had, that we're paying the price for today. People, Latinos, have lost their lives in far greater numbers, gotten ill in far greater numbers because of the significant number of uninsured. And when you have 1.5 million undocumented people who are uninsured, who don't have health coverage because they have the lowest number of health coverage by employers, by industry. They're not covered. They can't even pay for insurance through the ACA and Covered California. So that led to these significant problems because the underlying conditions were not dealt with, and we need to deal with them today as we move forward. Thank you.
Thank you, Senator Durazo, for your words. I think everyone has felt it, and anyone that has lived in those communities or worked in there, it's been such a challenge and such a tragedy to lose so many in our families. I'd like to now introduce Assembly Member Robert Rivas. He represents California's 30th Assembly District since 2018, which includes the Central Coast cities such as Gilroy, King City, Morgan's Hill, Salinas, etc. While he's still in his first term in fall of 2020, he was appointed as chair of the Assembly Agricultural Committee and elected as vice chair of the influential Latino Legislative Caucus. He is the current chair of the Agricultural Committee in addition to the Select Committee on Ensuring Systematic Equity Post-COVID-19 and many others. His California Farm Worker COVID-19 relief package passed last year, and it was one of the first in the nation to provide these protections. Our caucus is proud to support his current bill, AB 125, the Equitable Economic Recovery, Healthy Food Access, Climate Resilient Farms, and Worker Protection Bond Act, a $3 billion effort to accelerate California's economic recovery and improve the state's climate resilience, while also increasing healthy food access and protecting essential food and farm systems workers and investing in regional food and processing and marketing infrastructure and promoting sustainable agricultural practices. The Assembly member graduated with a bachelor's in government from CSU Sacramento and earned a master's in public administration from San Jose State University. Raised by his mother and grandparents in a farm worker community, he was able to witness his grandfather stand by his side with Cesar Chavez and the UFW as a leader in the right to fight for equal rights. Thank you for all you have done on the front line with all these workers, especially the farm workers, which are all dear to us, having had yesterday Cesar Chavez Day. Welcome, Assembly Member Rivas.
Well, thank you, Alicia, for the introduction, and certainly appreciate the opportunity to be part of this panel. Always great to join my colleagues from the legislature, especially from the state Senate. We all serve in the same legislature, and so people assume that we have constant interaction, but that couldn't be further from the truth. I've just in passing, I've had the opportunity to say hi to Senator Newman, but obviously have very close interaction with Senator Durazo. Very lucky to have the opportunity to work with her in the Latino Caucus. She's such a champion. And certainly has been a great example for not only me but for our caucus, and so we're very proud to have her as chair. But really appreciate the work of the Latino Caucus from the League of Cities. I value and really appreciate all the work that is done at the local level. I think we all do. I served 8 years in local government, 8 years as a county supervisor. So I know how challenging the work being a local elected official is, and especially now amid this once in a century pandemic and public health crisis. But really refreshing to hear Chair Durazo and Senator Newman and their updates, very comprehensive, and certainly the work that they're doing has made all the difference for our most vulnerable populations here in the state. But certainly I think now that we are a year into this pandemic, and on top of all of the struggles and challenges it's created for not only parts of the state but for our entire state. This has been a pandemic that has touched and it's disrupted and impacted the lives of everyone who lives here. And certainly it's reminded us of the inequities in our health, our economic, our housing, and our emergency response systems here in our state. And it's these inequities that have been longstanding for our most underserved regions of the state, for our most vulnerable populations. As was mentioned, we talk about the impacts of this pandemic in many of our regions where assessing healthcare has been a longstanding problem. As Senator Durazo mentioned, housing, the critical overcrowded housing that exists in our state. Our state, we continue at the local level, at the statewide level, to face what seems like an intractable housing crisis. And in many areas here in California, certainly the region I represent, in the Salinas Valley in particular, my own home county, San Benito, in the Pajaro Valley, this is a diverse agricultural region. We have over 100,000 farm workers. Many of them, about 70% of them, are estimated to be undocumented. And I know this because, as was mentioned in the introduction, I was raised in by a family of immigrant farm workers, where I grew up in farm worker housing. I grew up in overcrowded housing. But the housing crisis we have in California today certainly is a crisis, but in regions such as my own and other regions across the state, it's a humanitarian crisis. The way that our essential workforce, the way that undocumented residents are forced to live in, they face mass exploitation in the housing arrangements they have, where they sublet a garage, a shack in a backyard. 4 or 5 families to a single family home is common. I have met with families where their children face multiple urinary tract infections because their children, school-age children, elementary-age children, can't use the bathroom because, according to the bathroom schedule, it's not their time to use the bathroom. It really is a huge problem. But not to mention the digital divide. A lot of attention has been placed on expanding access to broadband. Well, this is a longstanding problem for many areas, especially rural areas of this state, and certainly as it relates to having the opportunity to do some telehealth, having the opportunity to have equal access to education through some distant learning. This has become a huge equity issue across the state, and so certainly I think another thing we've experienced this year, especially working as a member and now vice chair of the Latino Caucus, is certainly fighting for our most vulnerable population, which is our undocumented residents that contribute so much to this state's economy. And as I mentioned, having now represented this agricultural region and been a lifelong resident of this region, for us the primary essential workforce has been agriculture, and so certainly working within the caucus, we've been fighting very hard, working with this administration to ensure that they have the supports and resources that haven't been made available to them in the way of stimulus or just some government services and support. And so certainly trying to mitigate all aspects of this pandemic. As of this morning, as a state, we've had over 3.5 million confirmed cases. We are nearing closing in on 58,000 deaths statewide, and we know, according to the data that's been made available, all of these confirmed cases, all of these COVID-19 related deaths have fallen disproportionately on our state's essential workforce, and primarily on our state's Latino, Black, and Native American residents, and those communities and those populations. And so been working very hard last year. We continue to work this year to try to mitigate many of these challenges through legislation. As was mentioned, the COVID-19 relief package that we had introduced last year. Our Latino Caucus has been very, very active in supporting many bills on the legislative front, but also working very, very closely with Gavin Newsom and this administration to advocate for the needs of our most vulnerable, especially with really across the state. Especially Latinos who have been hit the hardest across California. And so we have certainly, all aspects of this pandemic. Our focus has been on equity, ensuring that we've had an equitable response to this pandemic, from testing to contact tracing to workplace protections, as was mentioned, and now as it relates to the distribution of a vaccine. Our caucus was one of the first to advocate for the need of essential workers, especially our farm workers, that they be given priority status for the vaccine. The governor answered our call and made them part of, I believe, phase 1B rollout. But in that letter that we sent, myself and Chair Durazo, we also talked about the need, as was mentioned by Senator Newman, about the logistics. Opening up a mass vaccination site in a rural area isn't going to meet the equity expectations that have been set by our state. It's not going to inoculate farm workers. It was going to require a lot of work. And so certainly what you have seen is a lot of work locally that has been done to set up the logistical frameworks to reach our hard to reach population. And so certainly now that we are seeing an increase in supplies, I know in our region, we have in the last 3 weeks inoculated over 15,000 farm workers, which has been a significant success through these clinics, these employer-based clinics, working with some community-based organizations, working with agricultural employers, working with local governments and counties. And so certainly, but it's required a lot of work. So certainly been very proud of the work we have done through the Latino Caucus and in the legislature. But certainly I think that the work we have a lot of work still ahead, as was mentioned by my colleagues. We have been working on many fronts to address and mitigate the many challenges and problems that this entire state has encountered, which vary and which are very different across California. But with that, really thankful for the opportunity to be part of this panel and look forward to the Q&A.
Thank you, Assemblymember Rivas, and thank the three of you. Thank you, Senator Durazo and Senator Newman. So I'm going to see if I can go through some of the questions that I've seen, and you can physically raise your hand and show me that you want to answer, so we know which one can do that. So one of the first questions says, we are over 12% unemployment in our city. This is from the city of Whittier. In what ways can cities partner with the state to get our people back to work? Who would like to take that one?
Well, I could take
Yes,
part
please.
of that. It's
Thank
not,
you. Thank you, Senator.
Sure. It's not the full answer, of course, but I just want to say without a doubt, there is really great opportunity for us to move forward into an economic recovery that includes all communities and gives brand new opportunities, work opportunities for members of our community that historically have been excluded or, put at the bottom of the list. And I'm referring to first starting at the federal level. President Biden has made clear an economic recovery that does a few things that we at the state level have started to do, but now need to put them together in a single program. This isn't exactly on the local level, but it is to point out now's the time to prepare and do what we need to do so that it gets done on the local level, which is where it will have the most impact. So President Biden, and then we have been doing at the state legislature, are talking about an economic recovery, one that leads in a very real, tangible way to jobs that are going to address our climate change problems and will address greening, the kind of green jobs that we need. whether it's infrastructure or, like I said, in a more defensive way, hardening of our communities, the resiliency that we need in our communities, all of that in a way that is addressing a need to clean and have cleaner future in communities of color, where the worst devastations have happened, the worst contamination like Exide have happened. So one, let's address that. Let's create the jobs and the careers that we need, that kind of training that lead to good paying jobs. I don't believe in training that leads to dead end, minimum wage jobs. That does us no good. And again, for our youth, our youth of color, to see themselves as the professionals in these careers. So a lot of money will be invested at the federal level to go to the states. The states, we're already starting to pull together what we call high road partnerships with businesses that do want to pay good union wages and benefits, and also address these other issues of ours. So we'll be doing that at the state level, which hopefully sets it up so the local level can be ready to go to recruit the men and women that will be needed to do this kind of work. So I hope that it begins to answer your question.
Thank you, Senator Durazo. Does anyone want to add to that, or should we move on to the next question? Assemblymember Rivas?
Sure.
And then
I completely agree with Chair Durazo, and I think one area where we're working, obviously there's a lot of work being done to ensure that we put our state on the road to recovery. But as was stated, we have to make sure that we are deliberately investing in our hardest hit regions, in our disadvantaged regions of this state. And I know whether it's through a lot of efforts that are being done now, as was mentioned in the introduction, a bill that we have, Assembly Bill 125, that seeks to diversify and invest in agriculture to support the workforce, to support programs that would go to incentivize a lot of the agriculture that is done here in our state. But there's also a lot of bond efforts around school improvements in infrastructure, whether it's a climate resiliency bond that makes these investments. But what we've done, we've introduced a bill working with Betty E to ensure that in all of these efforts, a large percentage, around 40% is what's been proposed, that these dollars are invested in our most disadvantaged areas of this state, because these are the communities that absolutely need it. They need the infrastructure upgrades, improvements, and also the job creation opportunities that would result.
Thank you, Assemblymember. Senator Newman?
Yeah, and Alicia, if I could very quickly to add to my colleague's comments, but it from a slightly different direction. So the best thing that we can do right now is to get people vaccinated and to prevent another surge. And it is not an overstatement to say, like, we are actually in a race against time, against new variants of the coronavirus. The faster we can get folks vaccinated, particularly those who are most exposed, right? My colleagues have spoke very eloquently about that. The more likely it is that the economy will start to rebound and unemployment will fall. If we don't do that as a state, we are completely unprepared for another surge to, at the magnitude that we've seen before. So as public servants, right, urge your constituents to get vaccinated, particularly those who may not know, particularly those who are hesitant, but also as public servants, force the state, force the counties to make sure that we get vaccines to where they're most needed and that plans make the most sense. And you folks have the best insight of anybody as to whether or not that happens. And if we can do that, the economy is poised to respond in a really positive way. If we don't, it's going to be a huge challenge.
Great, thank you. I'm going to go on to another question. This is about adverse health. This is also from the Mayor Pro Tem of Whittier. And the question is, thank you for your comments about adverse health impacts and overcrowding. How will this lesson shape housing reform? And who would like to?
So
Take
I'm waiting to defer to Senator Razo, but I guess I would start because I know she's going to say something similar. But this is my point of view. At the state, you're on city councils. We're wrestling with this incredibly hard problem. How do we create more housing, especially more affordable housing in California? We as a state over the last 15 years haven't done a particularly good job. The housing element, the RHNA process is really burdensome to cities. It hasn't done much to shift supply and demand. The best thing that we can do in California to reduce overcrowding is to create better jobs, right? We need to make sure that people have an opportunity to make good living where they're not in positions where they're forced because of problems with documentation and other things to live in overcrowded conditions. That's how we make California work. That's how we give folks the opportunity to live in better situations that don't lead them to be so vulnerable to these sorts of infections. We will work on housing, but the other thing we really need to do, and my colleague Senator Razo is a hero in this regard, is making sure that we find the resources and we have the leadership to provide better jobs and better pathways for California's workers.
I could add to that, to what Senator Newman said, is I'm on the Senate, the Pro Tem Senate Working Group on Housing. The particular focus that we were given to work on is production of housing. There are so many pieces to the housing crisis, the prevention of homelessness, and how do we move forward and out of that. There's so many pieces to the crisis, but we were sort of given the mission of what are the kinds of things that we could do to promote production of housing. And so there's a package of, I think it's 6 bills now that we have put together that address the issue of trying to be helpful on the local level to help local governments move production. So streamlining through the right to build without a lot of the requirements that are in place right now, how to streamline CEQA, how to take rezoning so that retail areas, right, can become housing opportunities. So there's about 6 bills that we packaged so far that address this, because we know that we have to have more production of housing. And within that package, each of the bills to some degree or another also addresses affordable housing. We cannot have only and exclusively market rate housing. We have to have some affordable housing as well. And I have a bill that's unique to Los Angeles with state-owned, Caltrans-owned land, and how to convert that into housing opportunities, which we're going to do in El Sereno. So there's a production, but a production with an emphasis on affordable housing and the tools to streamline that production at the local level.
Assemblymember Rivas, did you want to add? Or
Yeah, no, I completely agree with my colleagues. And I think, obviously having served at the local level for 8 years, housing is incredibly challenging. I think that, there's a reason why, housing issues here in California have reached this crisis point. As I mentioned, it's a humanitarian crisis in a lot of regions of this state. But certainly this one size fits all approach is very challenging. Obviously, the regulations at the local level are a barrier. I think when you look at the zoning capacity to build the housing we need, we don't have the capacity to meet the housing needs of this state. And that's why I think this is a discussion that's going to require a lot of innovation. That's going to require us to think very, very forward thinking, as far as how we produce the housing that we need across the state. And so certainly, at the state level, ensuring that we're providing local governments with the tools to meet housing goals. I think, you've seen some positive things in the way of ADUs in the state, but I think I'm a huge a proponent of missing middle housing, doing more to create naturally affordable units that are going to meet the needs of families, meet their needs from a affordability standpoint. And certainly we have a long way to go, but certainly it's going to require a deeper level of engagement, because the disconnect and a lot of the friction that we have seen on this housing is, it's not been helpful. And so certainly I look forward to a lot of legislation that has, that's been introduced, because certainly we need to do something for the millions of people that face housing insecurity every single day. The people that are falling into homelessness every single day. We are failing them, and we need to do a lot better. Not only at the state level, but at the local level as well.
Thank you, Assemblymember Rivas. There are some other questions, but there are some comments. One is from the Vice Mayor of the City of Lathrop. It is Jennifer Torres O'Callahan, and she talks about, let me see if I can scroll down and find it, in that San Joaquin was open to its first mass vaccination site at Stockton Arena, but we did not get enough vaccines to open it. San Joaquin is still in the purple tier, and it definitely ties into slow testing and now slow vaccine rollout in the valley. So this is about vaccines. And then former Mayor Ron Gonzalez talks about the report on the Latinx COVID deaths rate in Santa Clara County. So looking at it with a COVID lens, as far as the making it a priority for these areas that are, the testing and into the COVID, the testing and into the results and the data that's there. Do you have any comments to make about the rollout in our communities?
I think I'll start, and Senator Razo talked to you a little bit. The Latino Caucus has actually been very active and very forceful in reorienting the administration's approach to vaccines. But I mean, clearly there's a ton more work to be done. And so, I don't want to defend them, but I think it's fair to point out just how complex this enterprise is. There's actually, 58 counties, there's 61 different health departments. And at one time, there were 2,200 different entities that were being allocated vaccines. And we clearly weren't doing that with an eye on equity. And so I think San Joaquin is probably the extreme example, but I will give the administration credit. They are making progress. And I think we have been given the assurance that as vaccine supplies increase, you will see a proportional increase in emphasis on getting vaccine to those communities. But what we've also seen, which is encouraging, is where we've gotten vaccines and where we stayed the course on sort of rigorous precautions, we've seen rates come down very quickly in an encouraging way. And so that's what we've seen in my own area, which was at one point the epicenter for the whole state. And hopefully we'll see that fairly soon. Not soon enough, but soon in the Stockton area as well.
Anybody else wish to jump in?
Well,
Senator.
Here's my opportunity to put in a plug for one of my legislative proposals, and that is SB 56, which is expanding Medi-Cal to undocumented seniors as the next big step. And I say it right here because how we reach out into those communities, yes, it's complicated and there were so many entities involved, but if we had far more of our community have access to healthcare, they could have held on, in a stronger way as the testing, as the vaccinations, as everything came to their communities. But when you have 2.2 million undocumented Californians, the overwhelming majority of which do not have access to healthcare, then that's on us to fix. And it should be seen as part of the pandemic recovery, and it should not be seen as separate. So I really urge and ask for your help in supporting this bill. This next step would cover approximately 35,000 seniors 65 and over who are undocumented, who've contributed to the system. actually have subsidized the system through all their economic contributions. So I say that not as a fix right now for all the issues that Senator Newman pointed out, but without it, the other issues are not sufficient in any way, shape, or form.
Okay, we're getting close to the end, but I do have another question. It is, what can an organization like the Latino Caucus do to assist in the recovery? And I love the fact that we have different caucuses at different levels that are always working together. So what can the Latino Caucus as an organization do to support the work that you're doing and assist in the recovery?
Well, one of the things I would say that we are, that we do annually in the legislative Latino Caucus is to look at what are our priorities as policies. What are the policies? Now those changed because of the pandemic in a sense, right? Some moved up, you know, usually they're all like top priority, like number one, but you know, we have to sort those out a little bit and then really zero in on what that is. So we're actually going through the process right now in the Latino Caucus of what our legislative priorities are and what our budget priorities are to submit to the leadership, to the governor and to the leadership of the legislature. But I would say, you know, we need to, I think, step up and coordinate as much as we can with local government and Latino leaders to help identify and reinforce what the priorities should be at the state level. How to spend, you know, how to get involved in the budget process. That should include us as much as anybody else. When there's 40% of the population is Latino, then we ought to expect that, not that all the money's going to go just to Latinos, but we're talking about issues that primarily impact 40% of the population. We've got to be in that conversation in a very organized way, in a way that makes sense. It's not excluding anybody. It's just saying, if we want to fix, if we really want a true economic recovery, you can't exclude the needs of 40% of the population. If you want to fix the healthcare crisis, you can't ignore 40% of the population. So in that sense, I think we could do a better job, each of our caucuses, of working together.
Yeah, and I, you know, if I could add anything, I agree, you know, entirely. I think that there are many ways, many opportunities for us to work together to ensure that we are addressing the needs of Latinos across California, which is so diverse and so different in so many different ways. But, you know, I would be happy to work with our caucus staff to, you know, ensure that we do have that, you know, that work that we're in collaboration. It's very important.
Thank you. Senator Newman?
I'm flattered to be asked. What, as the non-Latino guy here.
You're
as with any constituency.
today.
Thank you. Thank you.
Well, I wanted to make sure that you felt included.
No, I appreciate it. So I will say active advocacy, right? And so especially now, especially given sort of how sort of convoluted the legislative process is right now, right? Given the pandemic. And so there is an opportunity. You can participate remotely. And I think it has an impact. I think Senator Durazo would agree with me. You know, please don't be shy. Please, you know, make yourselves available. Be present on our legislative hearing Zoom calls because it has an impact on legislators. It will have an impact on the decisions that we make.
Thank you. A final quick comment from Michael Zaragoza from the city of Placerville. It's more of a comment. I urge you to look at rent to own or lease to own affordable housing so we can build generational wealth in communities of color. Affordable housing is great, but if it's rentals only, we don't build a path towards home ownership. Just a quick comment. And now I'd like to ask our executive director, Jan Arriaga, for a few words about our caucus.
So I'll go ahead and take that. John had to leave. Roberto, I see that your hand is up. Did you have a question? You're on mute.
No, more like a comment to Senator Newman, Senator Newman. You are guilty by association, as you've heard the comments already made today about 40% of California being Latino. I'm sure that your district includes many, many, many Latinos. And I want to thank you for being here, because it shows that you have concern and you have empathy, and that you really want to be part of the solution and not be part of the problem. So I want to thank you for being here, and I will have some comments at the end. But I just want to make you know that while they might say you're honorary, you are much more involved than you think you are.
I appreciate that, but let me say, like, don't hold my whiteness against me. The future of California is Latino, right? 40% of California is California. We are the future, and we will see that in representation. We will hopefully see that in policy within the next decade.
Great.
Okay.
Thank you, Erica. Go ahead, Erica.
Thank you. So I am just going to give a couple words. Erica Arriaga with our Executive Director's Office, and I'm just giving a couple comments about the Latino Caucus. If anybody on today's webinar is interested in membership or just learning more about the Latino Caucus, I'm going to enter in our website and our email address into the chat box for you to connect with us. I just want to thank everyone who was involved in setting this up. Not only our legislators, but of course the staff that gets you here. We want to thank all of those. And if there's any connection that you would like to make with us, please email our office and we'd be glad to share your legislation. I won't put you on the spot right now about the package, Senator Durazo, but those 6 bills, we do a newsletter pretty regularly, so we'd be happy to share those. We do follow the Legislative Latino Caucus package of bills, that priority bills, every year. And so we share that with our membership. That's about 450 Latino elected officials in California. So please send that to us. Senator Newman as well. I just want to thank everyone who was involved in this, and I'll pass it back to Alicia, and please look at the chat. I'll send over that
Thank you.
Emails and website.
Thank you, Erica. Well, I want to thank all the participants, all of the folks that have been participating, all of the elected officials that have been on, sending us these great links and information. And I'd really like to thank Erica and John for putting all of this together for our Latino Caucus, and our president, Roberto Uranga. But most of all, I'd like to thank our guests, Senator Newman, Senator Durazo, and Assemblymember Rivas, for participating today and sharing this great information with our members that we can pass forward, and this will be recorded. And so I want to give the last word, as I've learned as a young Latina, you always give your last word to the Presidente. So, Señor Presidente, would you like to say your final word?
Well, kudos to you, Alicia, and thank you so much for being a wonderful moderator in today's program. You've always done a great job, and thank you for being here. Senator Newman, Senator Durazo, Assemblymember Rivas, again, thank you so much for joining us this afternoon. Very informative, very important information, and adelante.
Thank you. Thank you, everyone. Thank you.
Thank you, Alicia.